Question 77, systemic circulation, pulmonary circulation, fetal circulation, and remains of fetal circulation. Here you see the circulation within an adult. The large one is the systemic and the small one is the pulmonary. Pulmonary means lung. Pulmonary starts in the right ventricle, goes through the pulmonary trunk, into the pulmonary arteries, into the lung, through the pulmonary veins, into the left atrium. Then you have systemic or greater circulation from the left ventricle to the aorta, to the arteries, to the capillaries in the body, and then to the veins and into the vena cava, into the right atrium. And here you also have the portal circulation, where which is a part of systemic circulation. And then you have two capillary networks connected by a thin-walled vein, which is portal vein, and they are there to carry various substances between two organs. So you have arteries, capillaries, portal vein, capillaries, and then vein. The hepatoportal circulation, here you can see it starts in the branches of abdominal aorta and then gives capillaries in the spleen, pancreas, stomach, intestine, and then gives veins to the branches to the portal vein, and then capillaries in the liver to hepatic vein to inferior vena cava. Hepatic vein, inferior vena cava. Then we have the fetal circulation. Where the nutrient comes, or oxygen comes from the placenta. So you start with umbilical vein in red. It goes to ductus venosus in green. And then you go further to inferior vena cava, into the right atrium through the valve of inferior vena cava. And then it goes through the foramen ovale here between the atriums, between the atria. And it goes into the left atrium and into the left ventricle and into the aorta and to the head and upper limbs. And also, and then back you have superior vena cava into the right atrium, into the right ventricle, into the pulmonary trunk, through the ductus arteriosus here, into the aorta, and this blood goes to the thorax, to the abdomen, to the pelvis and lower limbs. And then get back to umbilical arteries, which are in purple, which goes back to the placenta. Now the remains of these structures, you have the round ligament of liver, which is remains of umbilical vein. You have the ligamentum venosum, which is here. You have the valve of inferior vena cava. You have the limbus fossae ovalis, where the foramen ovale is it closes eventually. And then you have ligamentum arteriosum, where the ductus arteriosus was. And then you have median umbilical ligaments from the umbilical arteries.